Hi friends, I am Dr. Pratap Singh Rathore. I have done the MD in forensic medicine, and today we'll continue with criminal abortion. In today's video, we'll discuss about duties of doctor in case of a criminal abortion. First of all, in case any case of suspected criminal abortion, if any woman comes to a doctor, first if he must ask the patient if he suspects the case to be a criminal abortion, he has to ask the patient to make a statement about the case if he thinks there is a criminal abortion. If she refuses, he should not pursue the matter, but he should inform the police that there is a suspected case of criminal abortion. Doctor should keep all the information if you obtain from her as a professional secrets. He should not disclose to anyone else. He must consult any professional colleague if he wants whether to discuss whether the case is criminal abortion or not. If the woman condition is very serious, he must arrange to record a dying declaration where he may be required to record whatever the dying words of woman is there and make a statement in the form of dying declaration. If a woman dies, he should not issue a cause of death certificate, but should inform the police for postmortem examination for further process. Now, coming to examination of a woman, if the woman is alleged having abortion, doctor may have to examine the living subject or sometimes even case of death where it has to be sent for postmortem examination for alleged abortion. Many times there are cases that the woman may be alive, but sometimes the criminal abortion, because of complication of criminal abortion, the woman may lead to death also. So there may be chance that the body has to be sent to postmortem examination. The findings are similar to that of found in recent delivery changes and will depend on the period of gestation. So any findings that signs of pregnancy will be present in any case of abortion, and the science depends upon the what is the period of gestation. So based on the gestation, the findings will differ, and mode of abortion procured and time elapsed between the abortion and examination. So time between the taken between abortion and the examination, all this will relate to the finding depends the findings which will occur. So mainly the signs of recent delivery will be present, which is commonly seen in case of delivery cases, and also based on the period of gestation, the signs of pregnancy will be present. Signs of pregnancy like any external signs like presence of linear, alba, linear albicans, or changes in the breast signs will be seen. So now coming to steps to examine the living individual. So there is a chances that both the cases of like living as well as that case may also occur. So first of all, we'll go through with what are the steps we have to take if the living subject comes to you and you suspect a criminal abortion. First, you have to send for requisition for concerned authority that to examine the case of criminal abortion. And female identification of the female should be made by use of identification marks. Then informed consent of the female has to be taken before examining the case. A female nurse is to be present if the doctor is a male. Brief history has to be taken about date, time, place of abortion, method used to procure the abortion. So these are taken from the woman herself. But if she refuses to talk, then the case has to be the police officer can do the investigations. Then history of illegal termination, what are the method, everything has to be noted down. Then you have to examine for clothes. So clothes, especially the undergarment, has to be examined for presence of any blood stains. So then stains for abortifacients. So method based on the methods, there may be some abortifacient methods may be present in undergarments, like in the form of some fluid or soapy materials, which are all should be preserved and sent for forensic science laboratory. Then clinical examination should be done to know the signs, whether the condition of the woman, to know signs of ill health, then any GI disturbances because of abortifacient method, and there are any signs of exhaustion should be noted. In case you suspect if the woman goes to sepsis, there will be signs of infection like pyrexia, increased in body temperature, chills and rages, pain in abdomen, and increased pulse rate will be present. So these are all signs of sepsis, and this has to be noted early as possible so that treatment can be given to save the life of the woman. Then in local examination, that is examination of the genitalia, the appearance of perineum, vulva, and vagina has to be noted. So you have to note whether the presence of any injuries are there or not. There may be abrasions, contusions, or laceration based on what the method is used. If the methods like just abortion stick is used, there may be chances that there will be contusions will be present. If the violent methods are used, there may be chances that vagina may be lacerated, may also be seen. Then condition of the os should be noted. If the cervical os is dilated in a stepwise manner, it may not be, it will be intact. But if it is dilated suddenly, the os in a cervical os may be ruptured also. If it is dilated slowly, it may be dilated for a few days and may show also signs of injuries due to instrumentation will be present. Then you have to note whether there is any presence of any recent tears are present or not. The marks of forceps instrumentation will be on the genital will be present. Factors and amount of discharge should be noted. So discharge, it may be form of abortifacient materials or the abortive discharge of abortifacient which is used like irritant juices will also be present. And in case if the woman is went to sepsis, the presence of with discharge violent purulent discharge will be may also be coming from the vagina. Lab investigation in case of living individuals like serum, blood, and urine has to should be sent. It will give a positive result for test for SCGs, which is a confirmatory for pregnancy. So it will be present. It will be positive for up to 7 to 10 days even after the abortion. In the abortion during early months of gestation, the signs will be of ill defined, whereas signs persist for a longer time if sepsis has taken place and if abortion has carried out in the later months of gestation. So if woman is in early months gestation, signs of pregnancy will be less prominent. So only the signs like sepsis will be present. But if abortion is carried out after few months of gestation, the signs of pregnancy will be more prominent. So those are signs in presence of science examination in case of living individuals. In case if there is a dead body has come in post-mortem examination, what other things will come to know. So conviction of person of criminal abortion should be based on autopsy, that is post-mortem examination of dead body, laboratory findings, and circumstantial findings, that is the findings found in the clothes, undergarments, or in the scene of crime, what other things are found. During autopsy, whenever there is a case of sudden death of a woman of childbearing age should give rise to a suspicion of criminal abortion. So if there is a woman comes of a childbearing age, the following things may give a suspicion of criminal abortion, like the deceased was pregnant and deeply cyanosed. The instrumentation to procure abortion or abortifacient drugs are found in the scene of crime. Underclothing appears to have disturbed after death. There is a fluid or supplementary or blood coming out of vagina. So these are all signs are suggestive of that there is a chance that the woman has been undergone criminal abortion. So if there is a childbearing age woman is present has been found dead and with findings like signs of pregnancy are present, she is deeply cyanosed, instrumentations are found in the scene of crime, underclothing looks disturbed, or presence of discharge is present from the vagina should all has to give us suspicion that criminal abortion may be occurred. Following points should be noted and convict the abortionist. The dead woman was pregnant. So first we have to confirm that the woman was pregnant. So this can be done by presence of SCG and other signs of pregnancy like linea alba, linea nigra, other things will be seen. Based on period of gestation, the signs will differ. The accused was responsible for the act which resulted in the interruption of pregnancy. So this is very important for to know whether the accused has led to the abortion. So it has to prove that the accused was only responsible for and act of his led to the abortion. Then accused acted for the purpose of procuring abortion, illegal abortion. So accused positively wanted intent. There was intent for accused that had done criminal abortion, and it should be proved that death occurred as a result of attempt to interrupt the pregnancy. So here we should note that the intention of the accused was to procure a criminal abortion, which has led to death. So here there is chances like culpable homicide may appear, and the period of imprisonment will differ based on that. So if he has only intent to cause criminal abortion and because of complication the woman died, then the punishment may differ based on how the what are the conditions present, and if the woman's consent was there or not also will indicate the will change the punishment. There should findings to exclude the possibility of self-induced abortion should be noted. So self-induced abortion, sometimes the woman herself may try to cause abortion, like if she is trying to use her hand, there may be signs of itness may be present in the hand. There may be under the nail bed some artificial material may be also present. Those all signs will indicate that she may have tried to induce abortion herself. Then autopsy after the examination, external examination, if when the internal examination is done, autopsy examination should include absolute identification of the victim, careful examination of clothing, including undergarments, which would be preserved and sent for FSL for any foreign traces of foreign solutions. External fixtures of pregnancy should be looked for. So externally, first we have to confirm whether there is signs of pregnancy is not present. Clothes should be examined. Undergarment should be sent for FSL for presence of for any signs of artificial materials. Then, if there is a death due to hemorrhage, the body will usually look like pale. Then presence of injuries on genitalia should be noted and should be correlated whether those injuries are caused because of abortion or because of some other sexual offenses. If abortion drug was injected, then the injection marks or there should be detected at the usual sites. Then you have to examine the local examination of genitalia should be done for presence of injuries on the vagina, cervix, shows may be present, they may be congested. There may be stains will present of any local artificial changes may be found. If the artificial is irritant, there is chance that locally there may be congestion, signs of irritation will be seen. In internal examination, you have to confirm the other things, the complications of abortion has to be confirmed. To confirm excluded air embolism, like complication because of abortion, there is chance that the woman may die because of air embolism. The To confirm air embolism, the body must be opened after radiological examination as it may show translucency of right ventricle and pulmonary artery. So that will help to diagnose air embolism. If the abdominal cavity is open and may be full of blood, there is a if there is there may be perforation of uterus may be present. Uterine and adnexal tissues are assessed for crepitation due to gas formation in the uterine wall, and venous channels and inferior cava is inspected for air and soap embolism and bubbles. So, for air embolism in in right ventricle, translucent X-ray has to be taken. If there is a rupture of uterus, there may be hemorrhage may present in the abdominal cavity. If there is a air embolism because of which escape of air or soap embolism, there may be presence of air in the inferior cava as well as venous channels, as well as crepitation will be heard in the uterine adnexal tissues. A detailed examination of basal vessels, veins, and arteries should be done in the presence of air embolisms. The vagina uterus are opened along with the anterior surface and should be examined properly to confirm the signs of abortions. In the uterus, it may show presence of products of conception will be present. It may be present in full or in some bits and pieces may be present. It may be enlarged, soft and congested, that is uterus may be enlarged based on period of gestation. The wall may show thickening in larger sections and it will show that it was indeed uh, a pregnant uterus. Things should be collected in case of a criminal abortion. So first of all, vaginal contents should be pipetted in clean sterile container for chemicals, drugs, and soap materials. So this will indicate the what was the abortifacient irritant was used. Should note for that. Then pubic hair should be taken for, and on the pubic hair there may be chances that some stains like uh, saliva stains or pubic blood stains or some sweat stains may of the abortifacient, the person who is causing abortion may be seen. Blood, urine, and stomach contents has to be sent for poison detection. Blood and inferior cover should be sent for other examination for the abortifacient drugs. Any fluid from uterine cavity should be examined for abortifacient materials. Swabs from uterine wall should be sent. Tissue histology of all organs should be done to exclude any other causes. Trauma and abortion. In sometimes The abortifacient, the person who is causing abortion may try to correlate the trauma with the abortion. In case of suspected abortion because associated with trauma, this following points has to prove that the trauma is associated with abortion. So first, you have to note down that traumatic event was followed within 24 hours by process that ultimately led to abortion. So trauma and abortion, there should be a minimum of 24 hours should be present. So if more than 24 hours has happened after trauma, there may be chance that abortion was not directly correlated with the traumatic event. So appearance of fetus and placenta should be compatible with the period of pregnancy at which the traumatic event has occurred. So you have to examine the fetus as well as the product of conception, whatever is present has to be examined to note the period of gestation and the traumatic event, and it should be correlated with the same. The fetus and placenta is normal. It has to prove that the fetus and placenta is normal. There are no signs of injuries or instrumentation should be not be present in the placenta. The factors known to cause abortion should be absent, such as history of reptile abortion without the cause or exposure to abortifacients like X-ray or lead, chronic infections in mother, syphilis, toxoplasmosis, tuberculosis, abnormalities of uterus like congenital defect of uterine development, leioma, leiomyomas, adenomyosis, incompetent was physical attempt to induce abortion should also be absent. So when all these are absent, then only we can link that traumatic event was led to the abortion. So that this will exclude that the abortion was natural abortion and not because of as a form of criminal abortion. Now examination of materials alleged to have been expelled out. Sometimes a woman may bring expelled material that product of conception claiming that there is an abortion case. In that cases, the material has to be examined to note whether the material is actually a product of conception or not. Sometimes it may be just a blood in the examination of material. There may be blood clots, slides of membranes may be present. There may be chance of hide form more may be present. Tumor may be present, polyp or embryo or image of fetus may be present. So any of this material may be excluded, expelled from the uterus. That may be alleged as a form of like a expelled abortifacient material. Traces of worm are searched for in case of materials after washing it in the basin of water. Abortion cannot be definitely established unless the product of conception are found. So the expelled material has to be examined properly to confirm that it is a product of conception and not some abnormal things like hydroform mole, tumor, or polyp. If it is a fetus, its uterine age has to be determined. So it can be determined by length, breadth, length of the fetus, breadth of circumference of the head, circumference, or other things. The viability of child should be noted if the fetus is examined. If that is a viable, if there is a live born or stillborn has to be confirmed by doing some other tests like hydrostatic tests, other things has to be done. Lastly, some difference between natural and criminal abortion. Natural abortion is usually caused by some diseases present. Criminal abortion is seen in mainly case of unmarried or widow. There is a frequent case of infection is present in criminal abortion, not in the natural abortion. The marks of violence is present in criminal abortion, which are not present in natural abortion. Genital organs injuries, no injuries, but the injuries are present, like contusion, laceration, are present in criminal abortion. Toxic effects of drugs are absent in natural abortion, but erosions, inflammations, irritation of GI tract, urinary tract infection will be present in criminal abortion. Foreign bodies may be present in criminal abortion, will not be present in natural abortion. There will more foreign bodies will be present. Foreign bodies in criminal abortion includes like abortion stick will be present, instruments will be also be seen. Wounds are absent in fetus, that is process of conception. There are no wounds are present in the natural abortion. Wounds will be present. The placenta will be injured in case of criminal abortion. These are my references. Thank you.